Good evening to one and all. This is Dr. J. Vignesh. You are one of the moderators for the evening. We are in great pleasure. Our team AMD is in great pleasure in welcoming our honorable speaker, Dr. Avneesh Khare sir, who's been one of the top voices in AI in medicine. And we are so honored and privileged to have you on board, sir, for our first event. So over to sir for the further proceedings of the webinar.
So thank you so much. Thank you, Javnesh. So first of all, I would like to thank all of you for coming here on a Saturday evening to learn about AI. And I would like to thank the team of AID-MD to invite me to be able to talk to you. So I'll share my screen and just let me know when you are able to see it. So is it visible?
Yes, sir, your screen's visible.
Thank you so much. So the topic for today's talk is like for undergraduate medical students. We are going to discuss about AI. When Sanjay approached to me and told me that they want to hold a webinar for UG students, and I thought that what can be important for UG medical students to learn about AI? Because usually what happens is we go for PG exam and then we do specialization. But this is a very different like theme to be discussed in an undergraduate setting. So finally, we decided to structure the talk, and I have been able to do it. I have kept it quite simple so that you get a basic information. It means I'm assuming that all of you are new to AI. There might be some of you who are already in the field and they are quite ahead of me as well. But let's take a revision of what things are related to AI. Something about me, already Javnesh has told. So I am basically a clinician and I have 10 years of experience. But in 2021, I switched careers to become a medtech educator and consultant. I have limited myself to the field of AI and emerging technologies in medicine. And I'm associated with BrainX AI USA. This is a research consulting sort of a group. And we are doing a lot of projects related to AI in medicine. I was also fortunate to be a member of the NAMS task force for AI in healthcare. You all must be aware about National Academy of Medical Sciences. So they made a task force in last year and we submitted a report to Government of India, which will be implemented in times to come. So this is another, like you can see the report in the red color. And this is another event which I attended as a speaker. I was fortunate to be part of G20. If you know, we had the G20 presidency for 1 year. So I was participating in the panel as a digital health expert. And I was also quoted in the Forbes magazine for my thoughts. So that's all about me now. So you know that I have some authority to talk to you about AI in healthcare. So now we can take things forward. I divided the talk into answers for 3 questions, like the why about AI, and what is AI, and how do we proceed in AI? Because these 3 questions are in the minds of every new medical student or medical doctor who is starting to learn about AI. I was in the same situation in 2019, and since last 4 years, I have been finding answers to these 3 questions for myself. And I will share with you what I have learned. Like it will be like a experience sharing session. So feel free to just drop in your questions in the chat, which we'll be taking towards the end. So let's start with the why. So as Simon Sinek has said that once you have the why sorted out, then the remaining things fall in place. So you have to understand what is your why. Like your why might be different from my why, and my why might be different from third person, but we all should have a why before we start doing anything, including learning about AI in medicine. So these are some of the pressing issues which might give you your why. The first one, of course, is post-pandemic burnout. We all are suffering in some way or another. Whoever has worked in medicine post-pandemic, some have been overwhelmed and they have left the field also. So there's a constant dipping of workforce. Again, this has led to increased cost of human resources. And along with human resources, other costs of healthcare are also just going out of the roof. And many things have been tried to control the cost, but we have not been successful till now. So we need a novel solution to try. So maybe AI can be one of those solutions. Then you can see there are two graphs. One is the medical knowledge explosion and one is the digital data. Both are exploding at an exponential pace. Medical knowledge doubling time in 2020 was 73 days. That is only 2 months, a bit over 2 months, which now might be even 1 month. So every month you are reading something, it is becoming outdated in the next month, and you have to again update yourself. So this thing is going on increasing. So how you will sustain it, how medical professionals will be able to sustain the explosion of knowledge, this is something to be seen, because till now it has been manageable, but in times to come it might be not. Same with digital data. And as you can see in another other problems are that sometimes people are not so fortunate to have access to proper healthcare. And as you can see, this is the hospital in a remote part of Africa. This is all they have. So we are quite fortunate if we are living in a big metro city, so many hospitals, so many corporate and government hospitals, but all people are not lucky in the world. So we need to keep them in mind as well. And finally, the turnaround time or the time to deliver care, or the waiting time, or the time to get insurance reimbursements, all these times are so long, and they create a lot of waiting period in medicine. And there are a lot of bottlenecks. So these are the pressing issues which we have in healthcare. Whether AI can solve this or not is a thing to be seen with time. But AI is definitely going to change the equation for these issues. So how it is going to do it? Because there are some benefits of AI, especially in healthcare. Like there are innumerable benefits, but the main ones are that it can increase the speed and lead to more faster and accurate diagnostic results. So we can diagnose the disease earlier, we can start treatment faster, and we can save a lot of lives. And if we can backtrack this to the prevention side, then maybe we might reach a situation when person doesn't fall ill even, and we know beforehand and we can prevent the disease. Second thing is, one of the biggest causes of death is human errors. This is in all fields, including aviation. If you go to aviation and you Google and you search the main cause of airplane crashes, you will find that pilot error is number one, instrument malfunction is second or third. So in healthcare also, we are dealing with lives, human lives. So we need to reduce human errors, and AI has shown capability to be able to do that by automating some tedious tasks or routine monotonous things which are like prone to causing error. Third is, some people might debate with me that cost is going to increase, but I would say that in the long run, as with any technology, once scaling up happens, the cost tends to go down. We have seen this with smartphones, with computer chips, and with any technology in the future, we'll be seeing this. So AI will help in reducing cost by reducing wastes. And finally, a lot of telemedicine is happening now since COVID times. And what happens in telemedicine is a lot of digital data is generated. And to handle that, we need a technology like AI, which can help in streamlining the process and making it better. So these are the four main benefits of AI, which can be seen in healthcare. I would not say that we have realized all of them, but we are making progress towards them. And another thing I would like to give you a perspective, when you will go for PG or you will go into a specialty, you will be following evidence-based medicine guidelines. Whatever studies are there, you have to keep yourself updated. There will be level 1 evidence, level 2 evidence, depending on the RCT or cohort-based study, whatever it is. But we have been practicing this evidence-based medicine from long time. And we have a lot of data which is not being utilized or not being harnessed, and we are leaving it under the surface. So we need to now go under the surface and bring this intelligence-based medicine in combination with evidence-based medicine so that we can improve the future of healthcare. So this is something which I would like you to think after going back, that do we want to remain stuck in evidence-based medicine, or we want to really go under the surface and practice intelligence-based medicine? So one part of the why was that why do we need AI in healthcare? Another part is why you should start learning about AI. So if you can see, this is a dashboard for human health research. This website I have given on the top right corner. You can go and check yourself. So this is a real-time dashboard of research happening in AI in human health. And you can see from the graph, you will, if you have read a bit of statistics in your third year in PSM, then you can see that this graph is now becoming exponential gradually. And now we are reaching a stage where this is all very well with the explosion of knowledge, explosion of related studies. So you need to start. Then this is the landscape of AI startups. This is only related to generative AI because if you count the startups working in AI in healthcare, they can't fit into this screen. So I have just taken those who are working in generative AI and they are applying it to medicine. Generative AI is something like ChatGPT or image generation tools. So those are coming under the domain of generative AI. So you can see there are solutions in all areas. So from clinician facing to admin to life sciences to IT to like anything, and some companies working in that domain. So you need to up your game. You need to know about all these things that this is happening. Start more late, then this graph is going to become bigger. US FDA is a body which gives license for certain things, including drugs and digital softwares. This is a list showing the number of algorithms, AI algorithms that have been approved by FDA for use in clinical care. So once it is approved by FDA, then we become more sure that, okay, they have taken all due diligence, they have checked all the studies and everything, and now it has been approved for use in humans. Non-approved things are also being used. It is not an absolute necessity to be US FDA approved, but once it's approved, then we have better like confidence as clinicians and as patients. And as per my knowledge, last knowledge, around 700 algorithms have been approved by FDA. So if you go to their website, you can see a list of all algorithms. And this infographic has classified them specialty wise. You can see maximum are in radiology. And then very close next one is maybe cardiology, oncology. So these are the fields that are being impacted most by AI. Or I would not say impacted, they are being revolutionized by AI. Because if some people say that whilst choosing specialty, choose a specialty which is not prone to AI. But my thought is different. Choose a specialty which is at the edge of AI. It is adopting AI faster, so that you are at the edge of technology instead of lagging behind. So that those can be two schools of thought. So many of you will be giving next, and you will be choosing your specialty. So give a thought to this and choose wisely. So after all this, two things are clear. One is that the AI is evolving rapidly in healthcare and it is becoming a game changer with each passing day. You must have seen last year was an explosion of AI. The next year will be even more exponential. So embracing it is not a choice. It is becoming more of a necessity. And second thing is you can either be reactive or proactive. If you are proactive, you can help to allow to shape the AI rather than just being a user, like just being an end user or a customer. And this will help you to prepare better for future healthcare trends. So this is what I would like to leave you with, the message that health professionals who understand and use AI to enhance themselves will replace those who don't. AI will not replace you. Someone using AI will. So the demand is going to increase with time. Like in future, maybe you might see in job descriptions, there will be a line that are you having knowledge about AI, then only you can apply to this job. So you need to think about that thing right from now. You cannot dig a well when you are thirsty. You have to start preparing from today. So this is my message to you about why you should start learning about AI. I hope many of your whys is clear. If not, you go back and think and decide that is your why clear enough to get started. And if it is clear enough, then you can move to the what. So what is AI? When we move to this, I would like to have a small exercise. So if you can all just go to this, scan this QR code, or you can go to menti.com and put this code there. and just put one or two words which come to your mind when you think about AI. So let's see what our audience is thinking. So once you log in, you can just put words into it and submit, and they will start showing on the screen. Very good. New horizons. Let's see more responses. Okay. Let's get more responses. I think we are, how many people are there? So you can even submit multiple responses, I guess. So if something comes to your mind, you can put that too. Okay. So it's very interesting to see that none of them is repeating. Like everyone has a different thought process when they are thinking about AI. Some consider it innovative, some consider it a game changer, some consider AI decreases manpower. Of course, this is a big ethical issue. Then quality health for all, the next smartphone. So this is what we are talking our minds out. This is what goes on in our mind. And if you can see, there are different thoughts. So very nice. This was very nice to know. So let's move to the next one. So see, if you go to Google and you put what is AI, you will get hundreds of definitions. You will get confused, and each person has defined AI according to their own skill set or their own comfort level. But this is how I understood what is AI. If you see, this is a pyramid, and you can see there are 4 layers. The bottom layer is the data. Data is anything that is like numbers or anything which we feed or we write on a piece of paper. That is data, like it is raw. If I just hand it over to someone and don't tell them anything, they cannot do anything based on that data. So I need to add a bit of analysis or processing. If I do that, I enter the second level of the pyramid, which is information. But still information is useless for me if there is no context. So we'll be seeing an example of this. Just try to grasp this, that there are 4 layers and each layer is like a refinement of the previous one. And it is called the DIKW pyramid. So as you move up this pyramid, you reach the level of wisdom. And whichever organism is able to do this process of reaching from data to wisdom, that is called the intelligent organism. So this is what we are doing on a daily basis, you, me, everyone. We are gathering data, we are analyzing it, then we are adding our context, it becomes knowledge, and finally we use it for something which becomes our wisdom. If we are able to do this, we are intelligent. If a person is not able to do this, then they are called not intelligent. Same is with artificial intelligence. If an artificial thing is able to do this thing, then it will be called artificial intelligence. And the process is called learning. So if a machine is doing it, it is called machine learning. So now everything becomes simple. There are a lot of terms in AI. You will get confused: supervised learning, unsupervised learning, machine learning, deep learning. But all these have very simple meanings. And the more you try to read about them, more you try to learn about them, they become simple with time. And this is one of the concepts which helps you. So let us see an example. If I just give you a number 7, it can mean anything. It can mean your birthday. It can mean like the number of people in my house. It can mean hemoglobin of 7 milligram per deciliter. But only if I give you the analysis or processing, then you can know that it is okay, hemoglobin. But still, you cannot do anything. Hemoglobin of 7 milligram per deciliter in a male, in a female, in a child. What is this? Then I give you that it is in a previously normal person with history of trauma. Now it becomes knowledge. But still, some people might not do anything when they get this knowledge. They might just ignore and patient might die. But so they will not be called wise doctor. To be a wise doctor, you have to check for source of blood loss and arrange blood for transfusion. This is how you reach the top of DIKW pyramid, and you are called a wise doctor or intelligent doctor. If a machine is able to do the steps, then it will become artificial intelligence. So this is the simplest way to explain. I hope this makes AI very simple for you, and it motivates you to learn further. So like we have 5 senses, so AI also has 3 domains. The first one is vision intelligence, which is the most applied in healthcare, in radiology, like looking at the X-ray images or CT scans, MRIs, and trying to find the diagnosis. This is an application of vision intelligence. ChatGPT and all the text-based tools, like I speak to some patient and it automatically gets recorded and the note comes out from the machine. This comes in the area of natural language processing. So if someone tells you natural language processing, so immediately you should recollect that, okay, it is one of the domains of AI where we talk about speech, text, and all those things. And finally is robotics. Many of you will be becoming surgeons and you will be going for robotic surgery trainings and you will be doing a lot of surgeries with robots. That is another part of AI where everything combines and becomes a physical thing. So this is something called as machine learning workflow. Machine learning is nothing but a type of AI, the most common type of AI which is being applied right now. So what happens, what goes on behind the scenes, this diagram is showing you. First of all, you will identify the problem you are going to solve in your domain, for example, healthcare. Then you will get the data related to that problem. And you will clean the data because the data is sometimes missing. It is sometimes error is there, or someone has filled age in the address column. So you have to clean all that thing, because if you give garbage to the AI model, then you get garbage as a output. So once you clean and prepare and manipulate the data, then you train the AI model. This is where the main training happens. This happens in the cloud, and you train an algorithm and it becomes a model. So algorithm is something which is raw or untrained. And once it is trained, it becomes an AI model. Now that AI model you can use to test your other data, which has not been fed before. For example, you give an exam. So in exam, sometimes there are some questions which you have never read about. So that tests the true knowledge of the person. So similarly, you will test the model before deploying it. And even after deploying, you have to take continuous feedback and monitoring, because these models are going to change with more data. For example, ChatGPT, there was news some time back that the model performance is going down because it is using the data which we feed for training. And some people are just putting garbage into ChatGPT, and that might be decreasing the performance. So you have to also take feedback and keep improving, and you continue this cycle. And this is all about AI, which is presently, this is the technique which is used to train any AI model in the world, which you can think of. There are no other techniques or workflows. So let us see a few examples in the real world. This was all theory. So this is a cardio AI algorithm in which you will feed the ECG. And for example, you're sitting in a remote village and you don't have a cardiologist to help you. You just take a photo of the ECG, or you just record it in their device, and it gets uploaded to the cloud. And then using AI algorithm, it finds out the segments and the things inside the ECG and tries to label it. So it has been fed with a lot of ECGs before with labels, and the machine has learned based on those examples. And now it is trying to classify your ECG, which you have done depending on those examples. And a fair bit of accuracy has been found in these algorithms. So suddenly this becomes like a very good application of AI, especially for places like where they don't have access to healthcare, like the example I showed you in pressing issues. Such algorithms can be a boon for people living in those areas. Then again, I have taken an example from the MBBS subjects because I know you will relate more to them than the clinical thing. This is another example from pathology where you must have seen slides in histopath. And I don't know for you, but for me, I used to remember the slide by the which slide is broken from the side, or which slide is showing bigger color things. So there were some tricks to identify, okay, this is a thyroid slide, this is a uterus slide. But now see what has happened is with AI, you can easily classify the things which are present in the slide, and slide can see better than AI can see better than a human eye. We have reached that stage. So why you should try to segment, find out where the nucleus is, what the you must be able to just confirm the findings of the AI which it is doing, and it will do all the hard work for you. How many nuclei are there? What is the size? What is the type? And then you can just go and cross-check the report, and then you can go for the management part directly. So a lot of monotonous work, tedious work, repetitive work goes down, and this is how efficiency of healthcare improves and cost goes down. But everything is not hunky-dory, everything is not like a cake walk in the park. There are a lot of challenges in healthcare, and no talk is complete without discussing the ethical issues and challenges. So I don't want to give you a very rosy picture of AI. It is like there are challenges and we are finding out solutions one by one. I'm not saying that it is not going to be solved, but definitely they are present. First one is data. The healthcare data is not available, not accessible. It's privacy issues are there, consent issues are there. So we have to solve all these things by anonymizing the data at scale and making it interoperable. Like you can take data from one hospital and use it to train algorithm in the other hospital. These things have to be solved for data problems. Then there are some algorithms which are black boxes, like neural networks, deep learning. They don't give you a reason why they came up with an answer. And if you're a doctor who is expected to explain to the patient, like, why you doctor, you are suggesting this treatment to me, and you're not able to explain, then that becomes a very catch-22 situation for a doctor, and confidence goes down in using AI. So that is another problem, which is called black box problem. Then a lot of regulations are missing around AI. Everyone is doing whatever they feel like. It is like a wild west right now. And some countries like Europe and all, they have started coming out with regulations. US FDA has also come out with some regulations about AI devices. And this problem will be solved with time because the regulatory agencies are also learning about AI right now. So they will improve. Then in healthcare, there are multiple stakeholders. There's the doctor, there is the patient, there is insurer, then there is employer. Everyone is involved in healthcare. And you cannot develop AI which can solve problems for everyone. There has to be customized, personalized solutions, but then again, it should not be such that it cannot be applied, because in healthcare, there are something called decision makers. So it should also be according to their priorities. If it is good for me as a patient, but then it is not good for the entire system or not cost effective for the system as a whole, then it will not be implemented. There will be problems. So that has to be solved. Then you all know, you must have, I don't know you have done internship or not, but you might have seen that many things which we read in the book don't work in the real world as they are written in the book. That is because complex workflow is there. There is a lot of uncertainties, a lot of unpredictability. So that has to be accounted for by AI, which is not possible till now. A lot of things are still working in the lab, but not working on the bedside. So that issue has to be solved by maybe some new techniques or by incorporating all those scenarios by running simulations and all. So that has to be done. And finally, what we are doing right now, we are trying to build our skill set in AI. This is missing from our medical curriculum. It is not a mistake of the teachers. They themselves are not having much idea about this new technology. So this has to be done also. Adopt AI in healthcare. So now, see, covering the what in 30 minutes or 40 minutes is not possible. You have to keep learning. Even I am learning every day. 2 hours at least I read every day about AI. There are new developments. This, what I gave you, is just a crux of everything. It is not comprehensive. Like you have to do courses, you have to join communities, you have to be in constant touch with experts to be knowing more about the what, and it takes time. It is not possible to do in 1 day or 2 days. So just give yourself time, don't get overwhelmed, and try to learn more after this webinar about what is AI. So finally, let us move to how. Now a question in your mind is that, okay, my why is clear. I should learn about AI. What is AI? I have started understanding a bit what is AI. It is not rocket science. It is not something out of the world. It is something which is built by humans. I can also do it. So how will you do it now? This is the main question. So if you see, there was a very good paper in October 2023. This was called the evidence-based artificial intelligence education. So this is how they are planning to do it. They have identified 3 roles for doctors of future. One is a consumer who just uses the technology. Another is a developer who makes the technology. These are 2 ends of the spectrum. And then there is someone in between who is called a translator. For example, I am a translator. I don't do coding. I am not a developer. I don't have a startup. I have not built a AI tool by myself. And I'm also not a consumer. So I am someone who is a translator. I know both the languages. I can speak, cross speak to both sides. I can help the consumer understand the developer and developer understand the consumer. This role is going to be a very big role in future. But what is important is that you have to understand the organization. Like you can see, the consumers are on the outside completely. They are on the surface. Then the developers are in the core, and in between are translators. And these are the things which you need to know, like technical concepts, what we discussed a bit right now. Then ethical issues you need to know. Then you need to know how to appraise the AI tools, like how to evaluate them, how to validate them. But depending on your position in this diagram, your level of depth of knowledge is different. For a consumer, he doesn't need to know technical concepts in so much detail as a developer. And a translator needs to know, doesn't need to know technical concepts like a developer. They can know less of technical and more of ethical, more of validation and appraisal. So you have to decide first where you want to stand in the future. You want to be a consumer. It's fair enough. Everyone is not going to become a developer or a translator. The maximum people are going to end up being informed consumers. So if you decide to be informed consumer, still you have to read about AI. It's not that you will use whatever comes to you, but a translator has to read more and a developer has to read the most. So let us see in our audience, what is the distribution, whether you want to be a consumer or you want to be a translator or a developer. Setting your goal is very important. Setting your aim, what you want to do. If you're not clear about what you want to do, then you can't be clear on what to read, how to reach there. First, you have to set it. So once you give answer to this question and give it to yourself, tell yourself, okay, I want to be a developer, I want to be a translator, I want to be a consumer only. So then you will be deciding how to proceed further. The steps I will tell you in the next slide. That's nice. So that's like a fair bit of distribution, and it's very common across audiences, across the geographies. Maximum people would be landing up in the translator side. They want to, they might or not, but then maximum will be consumers, then translators, then developers. But we should all try to become translators at least. So this is a good distribution, and I'm happy with our audience that like they are willing to go one step ahead, and they are willing to become translators, and 30% people want to become developers, which is a very good thing. We build AI for ourselves so that we own that AI. So moving on to the next slide, let us see a step-by-step approach. It's not going to happen in 1 day, 1 hour, 2 days, 2 hours, 1 weekend. It's not going to happen. You have to first build your foundations. See, any building which you build, if the foundation is weak, then it is not going to stand. So whatever we discuss in the what right now is a part of the foundation, like knowing about AI, what is AI, knowing the terminology, becoming easy, comfortable with them. When you came in first MBBS, you must be very confused about some terminologies and what these teachers are talking, what these seniors are telling. But now you are more comfortable because you have passed 5 years in medical science. Same happens with AI. So you start with introductory courses, but go for courses which are focused on medical field. Because if you go for too much technical side straight away, then you will get lost in the jargon of the technical world, and you will not be able to relate it. Also try to look for certified courses which give a certificate so that you can showcase that you studied, and just try to be very choosy in courses and try to take courses from good credible sources. There are a lot of courses on Udemy, Coursera, and there are many personal courses as well. I am also coming up with a course. So I am trying to condense everything which I have read in 4 years into one course. So you get a crux of the information in one go. That is the advantage if you learn from a credible source. Then after learning, don't keep learning. Don't keep doing courses. Don't keep doing 10 courses, 20 courses, 30 courses. It's no use. Just do few courses and start getting your hands dirty. get into the real world. See in your domain, for example, you are interested in surgery, go and look where surgery is applying AI. If you are interested in endocrinology, go and see where endocrinology is applying AI. Nowadays with Google, it is very easy. You can go to Google, PubMed, just type words AI in endocrinology. You will get so many papers and you will get a feel of what is happening in that field. Once you have done this, now you can go for hands-on. You can build your network. The most important thing is networking. Get in touch with the LinkedIn founders of companies. Just cold message them, cold email them, whatever gets you interested. Try to get into projects you can do on the sides as well. Maybe you are doing a clinical job in the daytime. So in evening, you can maybe 1 or 2 hours, you can work with some AI startup and develop your portfolio. Because what happens is certificate will get you the first opportunity, but it will not get you in the field. If you want to permanently get into the field, or some people who are thinking about becoming developers who want to go into the field full on, then they have to build a very good network and be very active in this hands-on exercise, because just reading about it is good only for informed consumers and translators, but developers won't be able to do it without hands-on. And finally, I told you I read myself, I read 2 hours a day. So you have to stay updated. I have subscribed to 6 or 7 newsletters. So I read them every day and I get updated about what is happening in the field. I share information. The best way is to start teaching. So start teaching your colleagues, your peers, your juniors about what you read. And that is how you can stay updated. So only 3 key messages. Like learning it may be overwhelming. For me also, it was very difficult, but with time, it becomes achievable. You have to be persistent. Continuous learning should be there. You should be consistent, show up every day and seek guidance. Don't be afraid to ask for help. There are people who are 2 steps ahead of you. So just ask them, just reach out to them, and most people are happy to help you, maybe in a formal or informal way, and try to pass it on to people who are behind you. So finally, I'd like to share something for people who are really interested in going 1 step ahead from the informed consumers to translators or developers. Developers, I would say not much. They have to do courses in Python and programming languages and all. But you can go to my website. This is www.avneeshkhare.com. It's under process. I'm building some courses which will be released soon. So you can have a look if you feel it is valuable for you, if it helps you in getting started, getting from 0 to 1, then you can consider that. This is one of my newsletters, and it is a fortnightly newsletter. I think it was shared on the group as well, the link. So you can go and subscribe to it if you have not. I share the updates, news updates, and research updates every week so that you can stay updated. I do the curating job for you. So you don't have to spend time searching for credible things, and they pass through my filter. So you know that, okay, this news is important. Because if you go and search yourself, you will find hundreds of them and you will be confused that which one is important or not. Second thing, if you are really serious, okay, I want to now learn more on a daily basis. I want to get messages, snippets on WhatsApp, and I want to learn in a digestible manner. Then I have a community as well, where I send daily small messages. Like I make a one concept of AI easy. Next day we are sending a research paper. Then next day we are sending a startup summary. So that ways, and weekly roundup. So this, if you are interested in more intensive exercise, then this is for you. And finally, you can always reach out to me. I'm on TopMate, and that is how I and Sanjay got connected and we came in touch. So it's quite powerful. Like sharing of ideas always leads to something new and novel. And I always tell medical students lag in this domain. We are mostly networking within our circle, within our domain, within our specialty, within our hostel, within our medical college. But get out of it. Get out of your medical college, your community, your medical circle. Talk to technologists, talk to people in IIT, talk to your friends who are doing some MBA courses and try to know more from them. So I would end my presentation now with this thought for you. This is a diagram from like 1800s when electricity was being developed, and there was a magazine which printed this photo. So if you see this photo, you will see a lot of it is resonating with the present AI scenario. There are many doomsday people who are telling that AI will finish everything, we all will die, everything will finish. But this is the same concept which was being built around electricity at that time, that people will get shocked, everyone will die, don't build electricity. But that is not how technology or things work. We have to keep this in mind. And this is a very good saying by Andrew Ng. He's the person who builds very good courses. You can go on Coursera and check on those. He has told that AI is the new electricity. So just keep this thought in mind while learning about AI, that you are learning about a very transformative technology. Every answer is not there right now, but it will be figured out in the long run. And once it has been done, then it will percolate every part of our life. So the rate of change is increasing. So gear up, and you can take a screenshot of this, and you can reach out to me on my QR code. You will get all the information there. My email address as well. Just drop an email if you have any question, any query, anything. Feel free to reach out, or you can reach out to ADMD team, Sanjay, and they will connect you to me. Thank you so much. I'll wrap up and hand over to the team. Thank you.
Thank you, Dr. Avneesh Khare, for the very informative webinar. I'm sure all our participants have gained a lot of insight on the topic AI in medicine. I would now like to open the platform for a Q&A session. All participants, please feel comfortable to put forth any queries and doubts you have in the chat box, or you may also go ahead and unmute yourself and ask your questions.
I know it's a bit overwhelming and something new for everyone, but still you can ask any question not related to the field as well. Anything that you have, any doubt you have, just go ahead. So I think there's a question in the chat. So from Swaleha. Hi Swaleha. So how to start as a beginner? What course should be pursued? So see, I will tell you my journey. I started with a course on Coursera called AI for Everyone. So that was a very light course, and it helped me in getting the feel of things. But whatever I have told you today is like 90% of that course has been already covered. So I would encourage you to go for a course related to medical field. You go to Coursera, go to Udemy, check out my course when it comes out, or you can go for some American Board of AI in Medicine, but that's a bit advanced because it's a very bit expensive also for a beginner. It is like 40,000 rupees, and I did it when I was in Dubai. That time it didn't pinch so much, but to do it is a big task. So do a bit few courses before doing that course. Can radiology be completely replaced in future by Mohammed? See, no one has answer to this question, and everyone will give you different answers. There will be a lot of claims. Many claims have fallen to the ground. Some people told that by 2020, all radiologists will be replaced, but I don't see anyone being replaced. One thing is sure, people who are using AI are becoming more efficient and productive. They are using those tools in a better way. So I think radiologists won't be replaced, but people who are better radiologists and using AI tools, more efficient, more productive, low cost, they will replace those who are not able to do it. And I don't see any other way than AI to be able to do it. Radiology completely replaced. I think you mean completely automated. So many parts of the workflow which are routine or repetitive, they are prone to automation and replacement by machine, but human will always stay in the loop. This is what I see, and I want to see. I want to see human in the loop. Then how I got interested in this? I got interested because I saw the medical records in Dubai when I went. Here I was working in pen and paper. When I went there, everything was fed into the computer, and you could get data, you could analyze it, you could build something. So that is what got me interested in AI. How can I use AI in my internship? In internship, you can start with ChatGPT. You can start learning about it. You can start summarizing research. You can start consuming more information using AI. I think that is the easiest and best way to start learning about AI and using it and getting a feel of it. Before ChatGPT, it was very difficult, but now you can do it very easily. Then is there any advantage of medical students becoming developers? Yes, because you have the context. I told you in the pyramid that The person who has context is more intelligent. The technical people don't have the knowledge of medicine. They have not worked in a hospital. They have entered a hospital, but they have not been as close to the hospital things as you are. So that is your advantage, and that is where you should lead, and you can definitely have an edge over them. By learning a bit of technology, you need not learn coding. Nowadays there are a lot of no code tools also, so you can do with that also, and build equally good solutions which you can use, and then later on you can build a technological team around you, and you can refine that solution. So that is my answer. Newsletter to read. My newsletter is there. Then there are some newsletters which one of them is Rundown, RUNDOWN, Rundown AI. One is AI with Ali. So if you go to Google and type AI newsletters, so and I will send a few of those to Sanjay, and maybe he can circulate, so you can subscribe to those as well. The more you subscribe, the more, see, there will be repetition in all, but there will be something new in all as well. Thank you so much. Then what programming languages are commonly used? Python and R. If you are planning to learn coding, go for Python. Start with beginner level and then move on to advanced level. No code tools are Orange. Orange is a no code tool. If you go to Google and type Orange data mining, there's a no code drag and drop tool which you can use to analyze your data. Newsletter link will be provided in the group soon. Yes. As a third year student interested, how can I approach from ground zero? So research, see, you start using these LLM tools for research because I use it for translation, for summarization, for simplification. Consuming research and then producing research, both areas you can use AI. When you consume, then only you can produce something. So first consume it with the help of AI, consume more, and then start building it, because generative AI is something which generates. So you can generate your hypothesis, you can generate your research question, you can generate ideas for your study design. Then you can also, while writing the paper, you can generate your draft. So everything where you want to generate something, you can use that in the research field. Any internship opportunities? Yes, there's a company which I work for, which is called BrainX AI. They have started to come up with internships. They have taken the first batch now, and they are planning to refine it more in future. So if you go to brainxai.com, brainxai.com, then you can go and see there is an internship section, and you can go and apply. Another way is to go to LinkedIn, build your profile, and get in directly in touch to faculty at foreign institutes which are working in AI. That is another way. AI in microbiology, as I told you, in pathology, the same thing with slides in microbiology. Earlier diagnosis and all this virology is being revolutionized with the help of AI. Maybe in COVID also there was a lot of application of AI tools. So we'll be seeing more and more in microbiology as more and more pandemics and infectious diseases. I hope so they don't, but AI will play a very big role in making the process fast and more accurate. Is there eligibility? There is no eligibility right now. It's an open Wild West. Only you should know about it. Start running in the field. Don't stay still. That is the only thing. You keep thinking, you will fall far behind. Just start with whatever you can, however you can. That is my advice to you. Newsletter link again in the group. Thank you so much. R language, yes, R language is a very powerful language. It is easier than Python, some people say, but there's limit to AI application or machine learning for R. But in Python, there are more packages, and it is a more versatile language. So first learn R and then gradually learn Python as well. I know a medical doctor who knows 28 coding languages. He is an assistant professor in Chittorgarh Medical College. If we can learn 28, you can learn 2 at least, if you are really interested. How is India seeing the future of AI in medical diagnostic? Is there any kind of, if you have heard about Ayushman Bharat Digital Mission, it is a national initiative and it is a priority of our government. And there's a lot of AI work which is happening because now they have data. So they are even trying to train an AI chatbot like ChatGPT on the data. They are trying to detect frauds. There are a lot of frauds where people ask for money. They don't do the surgery but ask for money. Then how does the reimbursement person identify? So they have now developed AI tools for that. It is a very big priority for Indian government because of the scale and the cost saving ability of it. So I would say that. So I think those are the questions in the chat. Is there any question from anyone, they can unmute, ask if any question was not answered. Or you can reach out to me later as well. Just drop a LinkedIn DM or an email. Would be happy to respond. Free of cost AI tools, we should be using your top recommendations. Yes, as much as possible, Bing Chat, ChatGPT, Perplexity. There are a lot of free tools and every tool has a free tier. Go and use it, get the feel. And I have personally subscribed to ChatGPT Plus because I found it very useful for me. So once you identify a free tool which is helping you so much, then you can also subscribe for it. It will give you return on investment for sure if you use it in proper way. How do we address cybersecurity in terms of their data privacy? This is a very big issue. There are a lot of hacking that is happening now because of the old coding system that we are using. The encryption methods are old now, and with AI being into the equation now, hackers are able to crack those codes in a faster time. So some people say that when quantum technology comes in, when quantum computing enters, the entire encryption system will be rewritten and it will become more efficient. Till that time, data privacy and data issue is a big thing, and you have to ensure its security by using a proper vendor and ensuring that your data is secure. Still, leaks are prone to happen. So always try to anonymize the data. Don't try to put patient names into ChatGPT and all because they can be leaked. So just take that care. What is your view on Neuralink? My view doesn't matter. It is going to come anyways, and because brain-computer interface is something which is big for research, and it will be needed because if you want to communicate with devices, nowadays you have one mobile phone, one laptop, and one smartwatch, and this device number is going to increase. How are you going to communicate with all these things? This can be a pragmatic view. Some people might debate and some people might say that it is unethical and wrong, but we are going to enhance ourselves anyways. Smartphone is just an extension of yourself. If you realize it's just outside your body and nothing else. But all day you are stuck to mobile. Even Sanjay is doing mobile right now. So you cannot stay away from it. So brain-computer interface are going to come. When is a question, if is not. Then last two questions, which language can a microbiologist learn? Python. Difference between ChatGPT and Bing and others. Bing is giving you free access to GPT-4, which is getting paid in GPT Plus, but it's not so powerful as in ChatGPT Plus. Overall, their data training, everything. I showed you the machine learning workflow. That is different for every tool. The data is different. The training method is different. So there is slight difference in all. There are benchmarks available online. You can go and search which tool is better in which benchmark. So that will give you your answer. So I think that's all in the chat. Over to you, team. Thank you.
I would like to express my most sincere gratitude to you, Dr. Avneesh Khare, for participating and sharing your expertise about AI in medicine. Even despite your busy schedule, you have taken time to be with us today on a Saturday evening. Your knowledge on this topic is revolutionary. We know that this wouldn't be a successful webinar without your contribution, sir. I would also like to thank Dr. Sanjay and Dr. Jay Vignesh for organizing and putting together this webinar tonight. And lastly, I would like to thank all participants for your patient listening and your active contribution. I would now like to invite Dr. Jai Vignesh to tell us more about this community, how you can join and how you can contribute in this community. Over to you, Jai Vignesh.
So first of all, to all the participants who have made a grand success by being interactive with us. So the interest is the maintained, the level of interest is maintained in the webinar was so interactive. We were like really happy to see the amount of interaction in the text box. I hope sir was also happy to answer all the questions. So as you all know, this is a new community and this is the first event. Thank you so much for making it a very nice event. And this is one of the first events, and more events to be, we'll be organizing more events in future. We were very overwhelmed by the response from our participant side. So we expect the same support to continue for the future events and many sessions in AI and many other intersections of medical field. About every field, we'll make sure events are being conducted. And Dr. Avneesh sir, Thank you so much. Thank you so much for being, so friendly from the beginning, guiding us and giving us very valuable informations. And the Instagram link on the LinkedIn profile link for the community as well as Sir's newsletter. It'll be posted in the WhatsApp group. We expect people to, follow and continue giving us support and evolve with us if further. Thank you so much. Thank you so much, Dr. Sanjay, for providing me the opportunity. So thank you, sir. Thank you, Rupa. Thank you, Dr. Sanjay, and thank you, participants. Thank you.
Thank you, Javignesh. Thank you, Dr. Rupa. And thank you, sir. Thank you for taking the time to give here. So, Avneesh sir is really one of, he's a thought leader, to be very specific, speaking on the intersections of AI and medicine. And we really wanted to bring this to medical students as well. And so thank you, sir. Thank you so much for taking the time to give out this webinar.
My pleasure.
Yes.